All right, so in describing the scope of what the AME Church does, and I have several of AME members here. I'm so glad to have you here, but you know, it's not just about us. We're so glad that the faith community can come together. But looking at the scope, the importance of the outreach regarding health in the AME Church, first of all, we want to let you know that there are AME churches throughout the United States, in Africa, in India, Bermuda, Jamaica, the Bahamas, London, the Netherlands, and health commission directors are located and appointed in all the areas and in most churches. We're still working to make sure that every church, every local church has a health director, but we are certainly pressing forward with that as every year passes by. I am the Connectional Health Director, but we also have a medical director, and it's Reverend Dr. Miriam Burnett, and annually we make a report to the General Board, and the General Board consists of all the bishops of the AME Church and all the leaders of the church. So that is unique, and we are so grateful that along with all the other reports that come before all of the bishops, we are able to stand on the floor and discuss the health issues as they relate to the community and as they relate to our members at large. And our website is www.amechealth.org. I did it. Okay. We've been committed to health since 1793. And it's interesting as you take a look, I don't know if you've had an opportunity, but if you visit the city of Philadelphia, I want to encourage you to go by and see Mother Bethel. In Mother Bethel, there you will find a museum that describes about the AME Church and the Free African Society and how our first bishop, the Reverend Bishop Allen, and his wife fought yellow fever. And it was interesting. You can also take a look on YouTube at a clipping from Fever 1793, which talks about the Great Experiment. And in that episode, you'll see where someone is depicting our first bishop and discussing how he worked together with the city of Philadelphia when many were fleeing the city of Philadelphia because of yellow fever. They came to him because it's interesting. They noticed that, according to what they thought, that the African slaves were not getting sick from yellow fever, but that wasn't the case. So, but however, they reached out to Bishop Allen and asked him would he come and help and gather together nurses to come and help. And of course he said that he would because he felt that it would be a great opportunity. Now, of course, I'm saying to you, they thought that the African slaves weren't dying, but in fact that they were. And we know today when we think about prostate cancer, as we heard the statistics earlier, unfortunately, you know, African Americans still rank the highest in every disease condition that you can think of, including prostate cancer. But our commitment to health goes all the way back to 1793 when Bishop Allen fought yellow fever. He wrote a book, and it's the first copyrighted book by an African, and it's called The Great Awful Calamity in Philadelphia. In addition to that, he helped establish an insurance program to address the overall welfare of freed slaves, and the Health Commission is an active ministry and component in the AME Book of Discipline. The goals of the Health Commission include addressing health equity through community partnerships, and of course that's why we're here, because of the great community partnership that we have with PHEN. And we've been excited about the partnership as it grows year by year. We make sure that we e-blast information, we share information. We have AME churches represented today that are going to be on the panel. Before the congressman left, he told me that he's a member of an AME church in New York. So we are certainly active in different areas of the country and across the seas, as you'll see a little bit later. Other goals include empowering and educating the church members in the community, equipping church members with health, wellness, nutrition, and fitness information, and active and ongoing advocacy and involvement in the Affordable Care Act, including education, enrollment, and information. For example, in the city of Philadelphia, we were successful in ensuring that thousands of children were enrolled in CHIP, and we are going to be just as active in the Affordable Care Act. Projects and partnerships, the ones we want to highlight, certainly Prostate Cancer Annual September Awareness E-Blast. Empowerment Temple AME Church will host the Prostate Cancer Spirit of Faith Leaders Breakfast and Forum in October. We're always excited about the annual June Father's Day rally, and we post that information on our website. And we are excited that we had three AME churches in Washington, D.C., Reed Temple, right? Yes, in Philadelphia, the entire First Episcopal District participated, and a church in Los Angeles, we participated in the Father's Day rally, and we continue to make it bigger and better, and we're always excited every year when Mr. Farrington calls on us to participate. Of course, we participate in Let's Move, but I want to jump over where you see in red, in July, we declared July as Faith-Based Wellness, Health, Nutrition, and Fitness Month. And certainly that